Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and the channel is My Take on It with Dr. Victor Obasuyi. Today, I'm going to be taking you through 7 signs and symptoms that you should never ignore as far as the eyes are concerned. Of course, some of these symptoms will be benign, which means it's nothing really to worry about. But there are, I'm going to elaborate on why you shouldn't ignore them or when you should not ignore them. So, the very first one is when you have floaters, which are those black things that people see moving around. It comes and it goes after a while. Then, anytime you look at a bright background or white surface, you will see them. Those are called floaters. They tend to come, then they go. Then, flashes. So, floaters and flashes are number one. Then, number two, red eyes. Red eyes that persist. Number three, pain in the eyes. Number four, ptosis, which is drooping eyelid. Then number five, bleeding, or when you see bloodshot eyes. You wake up in the morning, the eyes you find it's bloodshot. You don't know what happened. That's number five. Then excessive watery eyes, sudden blurry vision. These are things that we shouldn't take for granted. So I'm going to go through each one to let you know when to panic or when to go see your eye doctor immediately. So the first one we talked about was floaters and flashing light. Floaters by itself is not a big deal. When you see those black things moving around, some people describe them as black flies moving around in their field of view. Could be in one eye, it could be in both eyes. Most times it's in one eye. Floaters by themselves is not a big deal. But it becomes a problem when you start seeing them frequently or the numbers start to increase or you start seeing flashing light with the floaters. In that case, it could be an indication that you have what we call a posterior vitreous detachment, or is a warning sign that you're going to have a retinal detachment. So you should go and check it out at your eye doctor. Flashing lights are accompanied by floaters. Go check it out immediately at your eye doctor. Then the next one is excessive watery eyes. For a lot of us, sometimes you go into somewhere where there's a little irritant in the environment, the eye starts to water just to try. Is a mechanism for the eye to flush it out. But if it persists, then obviously something is wrong. If the eye is watery and non-stop, then most likely either the eye is extremely dry, which could be a big problem, or there's a foreign body in the eye. Foreign body in the eye could be on the cornea. The last thing you want to do is to rub it or try to force it out. You're going to leave more scratch marks on the cornea, and it could be a bigger problem. What you should do is try to flush it with water. If you try to flush it with water and you can't get it out, then go to your eye doctor immediately or go to the emergency and have them take a look at it. If there's pain, obviously, then you know the cornea is involved. The cornea has a lot of nerves. So anytime the eye is very watery and there's pain involved, then the first rule of thumb is to get the cornea checked. So you go to your eye doctor to have it checked. Then when there's sudden pain, you wake up and you find a sudden severe pain in the eye, again, you should get it checked. Especially if there's redness involved, because it could indicate that you're having what we call an acute angle closure glaucoma. So you should go get it checked as soon as possible. Of course, there are other things that could be behind it, but I'm just talking about the main thing that we are usually afraid of. So flashes and floaters, the fear is retinal detachment. When you have excessive watery eye with pain, then most likely we're dealing with a corneal problem. If it's just watery, if it's just pain and the eye is red, then our greatest fear is either angle closure, acute angle closure glaucoma, or it could be uveitis. So it's important to have it checked. Uveitis could be an indication that you have a systemic problem, which which is exacerbating the condition. So it needs to be checked. Then the other thing is droopy eyelid. You find suddenly the eye starts to droop, especially if it is droopy lid means the eyelid is trying to close on its own, and it becomes a problem for you to keep your eyes open. That's called droopy eyelid, or the medical terminology for this is called ptosis. Anytime that happens, sometimes it could be stress related, but the greatest fear, with especially when it happens suddenly, is it could be an indication that you're going to have a stroke. So it's very important to have it checked. It could be an indication that you have a brain tumor, or it could be an indication that you have what we call myasthenia gravis. Again, it needs to be checked as soon as possible. But the greatest fear is an imminent stroke. So once you have a droopy lid, go get it checked. Then the next one is sudden bloodshot eye. Sometimes you wake up, you find the eye is just bloodshot. If there's no pain, this condition is called a subconjunctival hemorrhage. Usually, it is a benign condition. It will resolve on its own. It just means there's a broken blood vessel somewhere. Usually, if there's no pain involved and the vision is not blurry, then of course, and there's no history of trauma, then of course, is a benign condition. Usually, it takes a week or two for the redness to resolve on its own. That will usually happen if you've done like strenuous exercise, sometimes heavy lifting. People that go to the gym, they lift a lot of weight, that could happen. If you've been coughing or sneezing, or anything that requires that pressure can easily cause subconjunctival hemorrhage, or bloodshot eyes, as most patients will refer to it. But it becomes a problem if there's a history of trauma. Maybe something hit the head or something hit the eye, and you discover that you have that bloodshot eye. It has to be checked, because it could be an indication that is bleeding at the back of the eyes too, or that you have a brain something, there's a brain damage. So that's why when you have bloodshot red eye, you just don't ignore it if you have these other conditions that I mentioned along with it. If you've had a history of trauma, or sometimes something hit the head, or something hit your face. If there's a blunt trauma and you find that you have red bloodshot eye, do not ignore it. It is an indication that something worse is happening behind the eye or in the brain. So I just thought I will share these tips with you guys. Let everybody be more conscious. Know when to run to your eye doctor, and know when to give it a day or two before you panic. Especially now that maybe this COVID period where people are skeptical about going to their eye doctor. With these signs and symptoms, please go to your eye doctor, or go to even the emergency and have them checked. So I thought I'll share this with you guys. Thank you, ladies and gentlemen. I'll see you guys at the next video.